Hello. Wishing you a happy, healthy day full of energy. Please like and subscribe to us. Following your health practitioner's advice will help you reduce your risk of cardiovascular disease and maintain a healthy heart. If you have any unusual signs or symptoms, see your doctor immediately. Increased and lowered blood pressure is a concern for people with heart disease. 1. High blood pressure. Hypertension is a condition in which blood pressure in the arteries is increased. This is a common and dangerous health problem, especially for people with heart disease. Reason: genetics. Family factors can increase the risk of disease. Lifestyle: unhealthy diet, lack of exercise, smoking, and excessive alcohol consumption. Stress: prolonged stress increases blood pressure. Pathology: some diseases such as kidney disease and thyroid disease also contribute. Consequence: stroke. High blood pressure increases the risk of stroke. Heart failure: the heart has to work harder to pump blood, leading to heart failure. Coronary artery disease: increased risk of coronary artery disease and other complications. Prevention: healthy diet, reduce salt, eat lots of fruits and vegetables, limit foods containing bad fats. Exercise regularly. Exercise for at least 30 minutes every day. Weight control: maintain body weight at a reasonable level. Avoid stress. Practice relaxation techniques such as yoga and meditation. Regular health checkups. Monitor blood pressure and cardiovascular health regularly. Controlling blood pressure is one of the important factors in maintaining cardiovascular health. However, there are many common misconceptions about this that doctors often point out. Just feeling healthy is normal blood pressure. The truth is, high blood pressure doesn't always cause obvious symptoms. Many people have high blood pressure, but still feel normal. Therefore, checking your blood pressure regularly is important, even if you don't feel any symptoms. High blood pressure is not a serious problem. Fact: high blood pressure is one of the leading risk factors for heart disease, stroke, and kidney problems. Uncontrolled blood pressure can lead to dangerous complications and even death. Understanding and avoiding these misconceptions can help you better control your blood pressure and protect your long-term heart health. Hypotension. Hypotension is a condition in which blood pressure in the arteries is lower than normal. Although not as common as high blood pressure, it is also dangerous for people with heart disease. Reason: dehydration. Dehydration reduces blood volume. Pathology: heart failure, Addison's disease, and some other endocrine diseases. Medications. Some blood pressure medications or heart medications can cause low blood pressure. Blood loss. Injury or surgery causes severe blood loss. Consequence: fainting. Low blood pressure can cause fainting because the brain does not receive enough blood. Shock. Severe hypotension can lead to life-threatening shock. Organ damage. Lack of blood supply to important organs such as the heart and kidneys. Prevention: drink enough water. Make sure your body is always hydrated. Divide meals into small portions. Eat many small meals throughout the day to avoid post-meal drops in blood pressure. Change positions slowly. When getting up from a sitting or lying position, do so slowly to avoid dizziness. Monitor your health periodically. Check your blood pressure regularly and follow your doctor's instructions. 3. Timely first aid. To give first aid to people with heart disease, when blood pressure suddenly increases or decreases, the following steps should be taken. When blood pressure suddenly increases, stay calm. Reassure the patient to avoid panic. Put the patient to rest. Lie down in a comfortable position with your head elevated. Check medication. If there is blood pressure medication, instruct the patient to use it as directed. Medical contact. Call an ambulance or take the patient to the nearest medical facility. When there is a sudden drop in blood pressure, help the patient lie down. Place the patient on his back and raise his legs to restore blood circulation. Drink water. Give the patient water to drink if still conscious. Check vital signs. Measure pulse, blood pressure and respiration. Call emergency. If the condition does not improve, the patient should be taken to a medical facility immediately. Recognizing and promptly treating blood pressure complications is essential to protect the health of people with heart disease. Understanding the causes, consequences, and prevention measures will help us take correct and effective actions in taking care of cardiovascular health. 4. The role of family and relatives. Family and relatives play an important role in the care and support of people with heart disease, especially in managing blood pressure. Here are some suggestions for how families can help. Spiritual support. Create a comfortable environment. Helps patients feel secure and comfortable, avoiding stress and anxiety. Encourage and motivate. Encourage patients to comply with treatment regimen and change to a healthy lifestyle. Health monitoring. Monitor blood pressure. Regularly check the patient's blood pressure and record it to report to the doctor. Observe symptoms. Note unusual symptoms such as chest pain, difficulty breathing, dizziness for timely intervention. Dietary support. Prepare healthy meals. Cook dishes that are low in salt, low in sugar, and high in fiber. Help the patient drink enough water. Make sure the patient drinks enough water every day, especially in hot. 5. The importance of regular health examinations. Regular health checks are an important way to detect and manage blood pressure and heart problems early. Early detection. Timely detection of complications or diseases related to blood pressure. Adjust treatment. Adjust treatment methods according to the patient's current health condition. Medical advice. Receive advice and guidance from medical professionals on lifestyle, diet, and treatment. Expert advice. Regular health checkups. See your doctor regularly to monitor your heart health and receive professional advice. Perform necessary tests. Tests such as electrocardiogram, ECG, echocardiogram, or coronary angiogram may be needed to evaluate cardiovascular status. Managing blood pressure is an important part of heart health care. Understanding high and low blood pressure, as well as prevention and first aid measures, will help patients and their families be more proactive in protecting their health. Family support, regular health checks, education, and modern technology all play an integral role in this process. By taking the right steps, we can reduce the risk and improve the quality of life for people with heart disease. Cardiovascular disease is one of the leading causes of death in the world. To effectively manage and prevent cardiovascular disease, here are some in-depth tips from doctors.